Let's move right on then. And the government, we understand, is considering restricting the sale of medicines through online pharmacies, but could allow the use of digital prescriptions under the e-pharmacy regulations that are currently being drafted. Let's understand what exactly is being put into place. My colleague Sumita Karir joins in with that perspective. Sumita.
Online pharmacies might have to swallow a bitter pill, and the reason is that the All India Organization of Chemists and Druggists are up in arms against online pharmacy. Or not just that, the government is also thinking of tightening regulations in the sector to control businesses in the ecosystem. After all, it's all set to reach $130 billion by 2030. So let's understand what the big fuss over these regulations is. Essentially, the issue is over proper regulation of the industry. Now, at present, the industry is governed by the Drug and Cosmetics Act 1940, which regulates the import, manufacturing and distribution of drugs in India. The technology aspect is covered under the IT Act 2000, but complainants have been claiming that e-pharmacies are engaging in malpractices, pointing to the fact that these laws may be deficient. Now, some of the malpractices that they have quoted include, number one, predatory pricing because of deep discounting by online pharmacies, concerns of impact of quality of drugs, concerns over self-medication, data misuse, data collection and misuse, and of course it violates the privacy of individuals. However, the biggest concern is over the sale of prohibited drugs, drugs that are not allowed for retail sale without proper documentation or prescriptions. And this is the key bone of contention because it could lead to an impact on the health of patients. So the Ministry of Chemicals and Fertilizers has drafted some regulations. But then this issue is not new. Let's go back a bit. In February this year, the Health Ministry pulled up at least 20 top Indian online pharma companies, including Tata 1mg, Flipkart, Apollo, PharmEasy, NetMeds, amongst others. The Drug Controller General of India, or DGCI, sent show cause notices to some of these pharmacies. In fact, the trigger was a warning by the All India Organization of Chemists and Druggists that they would launch a countrywide movement if the government failed to take cognizance of their concerns that are listed above. Now, recently, a parliamentary panel too called for due diligence measures, guidelines and mandatory registration. Now, all of this needs to be seen in light of the fact that online pharmacies stepped up during the COVID-19 pandemic and delivered medicines within 24 hours, which proved to be a watershed moment for the industry. The e-pharmacy market is valued at $344.8 million in 2021 and now is all set to reach $130 billion by 2030 amidst an increase in medical spending, increasing investments and consolidation, and of course, growing internet penetration.
Let's also hear out what some experts had to say regarding the e-pharmacy regulations.
I'm not aware about what the concerns are because the government has not sort of engaged with us yet. We have written for a meeting, for an appointment. Hopefully, we should be able to meet them and understand the concerns and hopefully address them as well. The typical concern is today the kind of model we have falls under multiple ministries from a governance and regulations point of view. The platform, because it falls under the IT ministry, they are sort of governed by the IT Act.
The government could not make the e-pharmacy, e-prescription. As a result, it is stopped. And now we find that mostly these people are collecting the health data, which is they are violating the data security, data privacy, and data integrity of the citizens, which they are not supposed to do. Second thing, we have pleaded the government. Now the Honorable Prime Minister brought the National Digital Health Mission, which is covering Ayushman Bharat.
Not going to have one law which says for e-pharmacies, this will be the story. It just seems too difficult to do. You can't keep on tweaking it as technology improves. So it's just not practical. We haven't done it to Big Basket, Amazon, none of the others. So, e-commerce, if there are regulations, they will apply. The IT ministry will have jurisdiction over it. In this case, the Department of Pharmaceuticals will deal with the actual sale of it. How it is sold, whether it is sold online, on WhatsApp, it's a bit of too much detail. Tomorrow, if you have something beyond WhatsApp and online, then what happens? So I wouldn't go down that path. The legality of it is fairly well understood. I think you have so many of these startups who've taken good legal advice, including discussions with government. And if it was illegal per se, they wouldn't be operating in this country.
All right.